We are a very important agency. We welcome you into this world, and when you exit, we would also say bye bye to you. Let me say that the Birth and Death Registry is established by law, the Registration of Birth and Death Act 2020, Act 1027. We were established as an agency after the first post-independence census. Registration of birth and death started in this country as far back 1888. So we have a lot of historic records for the diaspora. Those who would want to do some research about their families during the colonial times. It used to be death registration, and in 1912, we started birth registration. So we have quite a number of data there that can be researched upon. And our mandate is to ensure that we record continuously, permanently, all births, all deaths that occur within the boundaries of Ghana, register them, and also issue certificates to them. This includes members of the diaspora. Once you live in Ghana, and you have a birth in Ghana, we are mandated to record that birth and issue a birth certificate for that child. The same way, if someone passes on, we are mandated to report, to record that death and also issue a certificate to that death. We are in all 16 regions of Ghana, and our offices are located in all 261 districts of the country. Registration is done within the location, the geographical location that the event occurred. So, for instance, if a birth occurred in Accra Metropolitan, then the registration will be done within the boundaries of Accra Metropolitan and nowhere else. These have statistical, geographical, and demographic implications in terms of statistics. I've been listening to all the speakers, and all the data they want, we have it. I mean, if they want to make projections, before you go to immigration, you have to pass through the Birth and Death Registry to get to a level in life before you can travel. So we are very key institutions. Requirements are simple. Registration processes are very simple. For birth, once the delivery happens in a health facility, the mother is given a maternal health record book that has some statistics on the mother's maternal records, and then when the child is delivered, that is all you need to have your child registered. So for us, we would request to see evidence of the delivery, and then we have a questionnaire that we have to complete, birth registration form 4. We interview you, get additional information, and within a space of 20 minutes, the registration processes are over. We issue the child with a birth certificate. The same applies to death. Once the event occurred in a health facility, the medical practitioner who was in last attendant to the deceased will have to issue a medical certificate of cause of death. Once you receive that, you report to the nearest birth and death office, who would ask for additional information. And in a space of 20-25 minutes, we should be done with the registration and issue with the death certificate. We also keep an archive, records of all the events that were recorded, and we are now digitally. Our operations are now digital, so you can have access to registration facilities. We have an online portal that you can visit us and then drop your applications, and we can attend to you. We are trying to reach out to everywhere and make the registration processes simple. As we speak now, we are integrating also with the health service and also the National Identification Authority. So once you have a child in the hospital will now send us direct notification about the birth of that child, and digitally we can complete the registration, and then NIA will pick up the registered child and also issue a unique identification number for the child. So for the diaspora community, let me say our services are now accessible We are open online, and you can also visit any of our registration centers. And the processes are simple. We are keeping it simple as much as we can. There have been some times where we think that once I have a child here in Ghana, then it means the child is a Ghanaian. And the answer is a yes and a no. It's a yes and a no depending on the status of the individual in the country. If the individual is already naturalized and has taken on a Ghanaian nationality, then that child has the benefit of every Ghanaian child. But if that has not been done, then it means you have to go a step further. There are processes that you need to go through to confer the Ghanaian nationality on that child.
What if if one parent is Ghanaian and the other parent is the diasporan? What's the case there?
Yes, so that's what I'm saying. Depend on the status
Okay.
of the couple, that will determine the nationality of that particular child. So it's differ from you don't have one street jacket that once the delivery is happening, but it is mandatory that once the child is born here, the birth has to be registered by us, and then we issue a birth certificate to that child, giving evidence that the child was delivered in Ghana, and the child have also added to the population of the children of Ghana. Let's bear in mind that that child would attend hospitals, would attend school. So the data on that child is very key. So reporting the birth of your children as soon as they are born is key for us to complete the registration processes and have a birth certificate to that effect.
Thank you. I'm glad to hear it's gone digital
Yes.
because when I wanted to, because I was born here, but I became a Canadian citizen growing up there. And when I came to Ghana, I remember it was in 2012 and I didn't have my birth certificate. And I went to the births and deaths office and they pulled out this big book from the guy went to like the back and pulled out this big book and he opens it and he had to flip through like individual pages where they had everybody marked down because he was like the year you were born, it was a long time ago, so they've compiled it all into a book. So it was really time consuming going through every page of that book. So I'm glad to hear that it's digital and more accessible for people to find the information going forward. Congratulations.
Yes, yes. So the digital processes I'm trying to explain is your application process, you can do it online.
Ah, okay. I thought you were saying now it's being kept like in a database.
Yes. So
Okay.
we have an electronic database. It is not open to the public.
Right, of course.
Yes, but the public portal, you can go to the public portal, apply for the service, you pay online. We are linked to the Ghana.gov platform. So you can, in the comfort of your home, do your application, upload whatever additional documents you need to upload online, do your payment online and submit.
Good.
And we have options. If you want a pickup, if you want your final product to be shipped to you, it depends. It's an option for the individual. So that depends on the individual and how you want your final product to be delivered to you.
Good, great. Thank you. Very good information, especially about the births of the children. Anybody who's giving birth here, and it's happening more often. More people are making Ghana home, so it's wonderful.